Assalamu alaikum. Welcome everyone. Thank you for joining us for today's webinar. Today we are focusing on COVID-19 and elderly patients with a great presentation by pharmacist Wafa ALbalushi. Dear colleagues, we are so happy to have this great time with pharmacist Wafa ALbalushi, who is currently working as pharmacist in charge at Nakhal Health Center. She got her MPharm from Robert Gordon University in 2015. She received her pharmacy diploma from Oman. She has a member of scientific committee in Oman Pharmaceutical Society, member and trainer of Smart Pharmacy program. Dear colleagues, if you have any question during the presentation, please type it in question and answer box, and there will be a time for question at end. Thank you, Oman Pharmaceutical Society, for this opportunity. For those of you just joining us, welcome. Now, let's invite our speaker to initiate our session. The stage is yours, Pharmacist Wafa.
Thank you, Pharmacist Hamida, for your introductions. And today, inshallah, we will talk about COVID-19 in elderly patients. So let's start together. So inshallah, today our talk will be about COVID-19 and elderly patients. Why I chose this topic to talk about? Because nowadays a lot of people and also a researcher have also confirmed that elderly patients are at higher risk for getting COVID-19, and usually the death rate for elderly patients are very high. So during my presentation, I will talk about different aspects, and I will answer with you three main questions. The first one, why are older people more at risk of coronavirus? What about specific chronic disease? What special consideration we can take in order to treat infection patients with elderly people? So as we told before, the elderly patients in our population is very high. We cannot never forget our elderly patients. Therefore, we need to treat our elderly with respect and dignity, and for sure we will never forget them. And we can also take our attention in order to treat them as much as we can. So talking about some data and evidence, there is a research which have been done and shown that 15% of people whose age is 80 years and above will be infected by COVID-19, and therefore they will die as a result. People over the age of 80 years, usually those are infected by COVID-19, have underlying conditions. So they have diabetes, hypertension, lung disease, and other chronic condition. The death rate started to increase from the age of 50 years and above. As we can see in this chart, the people whose age is 80 and above have a higher rate of death, which is about 14.8, followed by people whose age is 70 to 79 with a death rate of 8%. There is also a link between COVID-19 death rate with chronic condition. As we can see, cardiovascular disease account for the highest death rate, which is about 10.5, followed by a patient with diabetes with a death rate of 7.3. Never surprising that people with cancer have the lowest death rate, which is about 5.6. Why are older people more at risk of coronavirus? There is different risk factor associated with increased risk of getting COVID-19. As people getting older, their immune system will be weak, and therefore the underlying condition or chronic condition will be more higher at elderly people. Talking about elderly patient and immune system, their immune system, as I told before, is reduced. This is why, because immune system gears up in older people, there is also a higher likelihood of phenomenon called cytokine storm. This is where the immune system overacted and produced too many of the chemicals to fight an infections. The researcher found some evidence that certain pre-existing conditions, including coronary heart disease, chronic obstructive pulmonary disease, diabetes, hypertension, were linked to the higher chance of dying from coronavirus. They also showed that there were a relationship between age and risk of dying regarding the pre-existing conditions. So the main risk factors for coronavirus complication and symptoms are those patients who have heart disease, lung disease, and endocrine disease. So we'll focus on one of these diseases in particular. The first one, cardiovascular disease. As I told before, it has the biggest risk factor for dying of coronavirus, but nowadays no people know why this happened. This never mind the people who is infected by COVID-19 usually died because of a heart attack. People with underlying heart problem are more likely to become seriously ill and die from the complication of coronavirus. Talking about diabetes mellitus, elderly people with diabetes mellitus also at a higher risk because diabetes usually depresses the immune function and make it very hard for the body to fight for the viral infection. As we all know, both insulin resistance and diabetes are characterized as a pro-inflammatory conditions, and the concentration of the inflammatory markers are increased. When usually diabetes patient will have changes in the secretion of plasmin, interferon, cytokine, which will result in high risk of severe inflammatory reaction and more severe symptoms and inflammations. As I told before, viral infection will increase the blood glucose level, and therefore the risk of ketoacidosis due to the change in pH of the body fluid will be at higher risk. So keep an eye with your elderly patient who is affected by COVID-19 and they have diabetes for getting risk of ketoacidosis. We also, as a healthcare workers, need to advise our patients with diabetes to watch on their blood glucose level, and when necessary, they need to increase the insulin dose as they are infected by COVID-19 and the virus will have some changes in their body. Glucose level should be kept within reference range and they should be checked more frequently. Particularly, attention should be given for those people who is in isolation and just be sure that they will never get a risk of hypoglycemia. As patients with coronavirus, they will always forget about themselves and they will focus more about COVID-19 symptoms and complication, and they will forget about their diabetes as a disease. When it comes to the respiratory system, it is very important to focus on the comprehensive care of patients living with asthma, allergy, and COPD. As coronavirus will attack the entire respiratory system and progress extremely rapidly, as we all know that this virus is targeted at lungs, patients most often die because of the acute respiratory syndrome. Bronchoconstriction situation should be minimized as we can. Regular use of long-acting bronchodilators and inhaled corticosteroid dramatically will reduce the risk of fatal outcome of coronavirus. Moving to answer the second question, what is the special consideration are there when treating COVID-19 in elderly? And I think this question is very important for us as a pharmacist and also important for other healthcare professionals. So we know how can we help our elderly patient to reduce the risk and treat them as well. So the main things we need to give attention is the side effect and their compliance and adherence of medications. This is because usually elderly patient will have a little or more of physiological changes inside their body that will affect the pharmacokinetics and pharmacodynamics of some medications. So when we are talking about pharmacokinetics and aging process, usually elderly patients will have different absorption, metabolism, distribution, and excretion. And this is because their function or their origin function different from elderly or young person. So in absorption, we can see there is a reduction in GIT motility. There is also a reduction in mucosal area, as well as a reduction in gastric pH. So give attention to drugs that is mainly absorbed from the gut and intestine. Metabolism, which is usually takes place in liver, we can see that elderly people will have a low hepatic blood flow. Their liver mass will be reduced. This will result in increased bioavailability of certain medications. So we need to think about medication that have a narrow therapeutic index that we can, for example, use in COVID-19. This distribution, as we told, the elderly patient, the body and fat ratio, the water and fat ratio is different from young person. They usually have high fat and low water. Therefore, the distribution of such medication or some medication will be changes. So we need to give attention for protein binding drugs as well as active and inactive drugs. Excretion, which is usually occurs in the renals, have some limitation in elderly patients as because their kidney mass and renal clearance is reduced. Therefore, the chance of the drugs will stay in their body for a long time will increase, and the chance of getting side effects will increase as well. So keep an eye for the side effect, ADRs, drug-drug interaction as well when treating elderly patients with COVID-19. Talking about the therapeutic options available for management of COVID-19, there are no drugs or other therapeutic approved by the US Food and Drug Administration to prevent or treat COVID-19. Current clinical management include infection prevention or control measures and supportive care, including supplement oxygen and ventilation are used when indicated. However, medical specialists can only treat the symptoms of the disease. Many different treatment options have been proposed, and some older drugs have been used nowadays, and they've shown some positive outcome. One of them is an antiviral medication like remdesivir, some repurposed medication like hydroxychloroquine, supporting agent like azithromycin, and also some other groups like ACE inhibitors and corticosteroids. So when we are talking about such medication like hydroxychloroquine, we have to give attention with elderly people because the risk of QTc prolongation is high with hydroxychloroquine. Also should not be given with people who has myasthenia gravis, and we need to check drug-drug interaction as hydroxychloroquine has a very long list of drug-drug interactions. Azithromycin, in practice, they are using azithromycin in combination with hydroxychloroquine. And both those medication has QTc interval or prolongation. So we need to keep an eye with this one, and we need to obtain a baseline of ECG before starting the treatment. Talking about chloroquine phosphate for the treatment of elderly patients, hydroxychloroquine and chloroquine have been used since 70 years before as anti-malarial medications, but nowadays they are used for the management of COVID-19. The dose is usually 500 milligram BD for elderly people whose age is more than 50 kg. The lethal dose, which is the poisoning dose, is 2 to 4 grams. And we need to monitor our patients closely. As we know nowadays, a lot of people used to self-medicate themselves with hydroxychloroquine and they end up with dying. The metabolism and excretion usually occur in the liver, the metabolism and the excretion in the kidney. So we need to give attention to our elderly people not to affect their kidney and their liver by such medications. Adverse drug reaction, usually the people will get arrhythmia, neuromuscular pain, and other also side effects. So we need, before starting the treatment, to close monitor blood routine as well as maintain a normal ECG before starting treatment with chloroquine phosphate. You will have a question now in your screen, and you have to choose one answer from this question. So the drug that can cause QTc prolongation, is it celecoxib, Tamiflu, or erythromycin? Please choose one answer from those which will appear in your screen. You have only 10 seconds. We will show the answer later, inshallah, next slide. I think it's done. So chloroquine phosphate for the treatment of elderly with COVID-19, this is the message that you need to take with you, and you need to keep an eye while treating the patients with chloroquine. Elderly patient, before starting chloroquine, must obtain a normal ECG. Chloroquine phosphate is prohibited in combination with other drugs that can cause QTc prolongation, such as quinolone and macrolides. And that the question which I showed before, we can see the answers now. So 45% answer the right question, the right answer, which is erythromycin. Well done. So this is an example of macrolides, which is erythromycin. So you have to link this one. Never combine erythromycin with chloroquine or hydroxychloroquine because both drugs have QTc prolongation. Before starting chloroquine phosphate, we need to check our patient's electrolyte level. So keep an eye for the potassium, sodium chloride, chloride, blood glucose, and to check patients' liver and kidney function, just to confirm our patient is in the normal stage. Pharmacists and other healthcare professionals must pay close attention to the ADR after treating with hydroxychloroquine and to record it when necessary. So moving to answer the third question, how can we reduce the risk of COVID-19 for our elderly patients? So it is very important to practice social distancing and never isolation. As we told before, elderly people are very sensitive age group, and we need to keep in touch with our elderly people and never isolate them, because it is very important for us to keep their mental health within normal, and keep in touch with your patients. Just ask in between, call them in between, and try to just involve them as much as you can. Phone call, for example, they can be done for such healthcare workers like GP specialists, where no need for face-to-face appointment, because we need to reduce the risk of getting infection from the hospitals. Medication delivery, as a lot of healthcare settings started a WhatsApp service where the patient can send text with his ID card to the WhatsApp service, which is related to the pharmacy people, and they can prepare their medication, and later on they can call their relative, for example, to come and collect the medication without them being to the hospital. Home visits, this is maybe very important for such people, like elderly people who have a complication, or sometimes they, this elderly people have a lot of ADR or a lot of medication problem. So you can visit, for example, with one of the community staff nurse to check their medication, adherence, ADR, and polypharmacy in such cases. In conclusion, elderly people are at higher risk because of their age, as I told, their weak immune system, and because of the underlying condition they usually have. Aging process usually will affect the pharmacokinetics, and therefore we as a pharmacist, we need to give a higher attention to elderly people when treating them, especially those who are infected by COVID-19. As we told before, social distancing can reduce the risk of getting COVID-19 for elderly patients. And before concluding my presentation, I would like to encourage you all to be supportive, careful, alert, kind, informed, and smart, and be always safe. Thank you all for listening and your attention, and back to pharmacist Hamida.
Thank you very much, Pharmacist Wafa, for an excellent presentation. It was very informative and well covered. Thank you very much. Yes, older people are at highest risk, but we all must act together to prevent community spread. Now we know why the elderly patients are at highest risk, because of the risk factors, or because of their age, immunity system, and because they have a chronic disease. Just a reminder, please type your question in question box. The great success of online webinars encourage Oman Pharmaceutical Society to continue conducting online webinars. Please follow them on social media to keep. Dear colleagues, we reached to the end of the webinar. Thank you very much for your attending. Again, thank you very much. And thank you for your time and your support. And stay safe.